And so, Dr. Hafron, John and I were actually talking before you got here, so we actually enjoyed this conversation. And one of the issues he brought up is something that I think you would be very aware of, is that all around the country when urologists have discussions with their patients, the statistical information they tell their patients about the sexuality outcomes afterwards are so skewed and so varied that there's almost no norm. There's almost no resource to tell them that this is a legitimate outcome or an illegitimate outcome. How do you deal with that, and what do you think is a great resource for people to understand that important part of their lives after treatment?
I think that's an important point, because as a robotic surgeon, we struggle to report our results, to say what is an adequate outcome. We try to use questionnaires, we try to evaluate the spouse or the partner, and our data is not always predictive or clear. And when I sit down and consult a patient, I know what my potency rate is, I know the statistics, and I run through the numbers, but I say, honestly, this is really probably what's going to happen. In reality, we can go through the numbers, but your sexual function will be affected. The way that you have sex or sexual relationships will be different following treatment, whether it's surgery, radiation, cryotherapy, anything that you do will be affected. The nice thing is that we have a variety of different treatment and different options to work with, and it's nice that when the spouse shows up that she can be a partner with this, but your sexual relationship will change. How much it will change, it depends on where the guy's starting, his age, and a variety of other factors, but I think the key point is that I stress that it will change, and that you need your spouse to be supportive of this, and that we have resources to help you in the long run. And a quote I use a lot is that, because I consult patients from 40 to 80 years old on sexual relationships, is that as you age, your sexual relationship won't be like you see in the movies, won't be like when you're a newlywed, may not revolve around intercourse, may not revolve around a hard penis. And there's other aspects of sex that are probably more important than intercourse and a hard penis. And I get right up to these guys and tell them that, and I think that's important because there is a lot of marketing going on in medical treatments that I think misleads patients. And doing this surgery day in and day out and treating these patients day in and day out, there's nothing worse than a patient we don't meet his expectations, who is not aware of the potential side effects. And to me, I do enough of these treatments that I'd rather have an informed patient, rather have that patient know exactly what they're in for and what to expect, than to have a patient that is unhappy or feels like this wasn't explained to him. And I think what I try to do is get away from the statistics, because I know the statistics are flawed, and I just try to tell them that there will be changes, and I can get more detailed based on age and comorbidities, but just stress that it will be affected, regardless of what you do.